Good evening. Thank you, everyone, for coming. Awareness. So I did change the whole talk, but I kept a few slides because unfortunately some of the slides don't actually change. So this part I did not change. So it's still the most common cancer in Bahamian men. I don't know if the second line is actually right. I got this off statistics that I compiled a few years ago. It's probably not right. It's probably higher than that. But anyway, a few cases are diagnosed each week. It's the most common cause of cancer death in Bahamian men. I'm going to show you some graphs which you might find interesting. When it says every 2 weeks a man dies of prostate cancer, that's actually at PMH. So the actual number is probably higher than that. Well, actually, right now, we actually have 4 people who are either died or dying on the ward now this past week. So it's a bit of a blip, but not an uncommon blip. Now, here's the interesting thing, awareness. So this is one of my favorite slides. I'm going to explain it to you, right? So most people who have cancer, it doesn't have to be prostate cancer, but all cancers, they talk about, Bahamians will say I have stage 4 cancer. That's really bad, it's spread. For prostate cancer, things are either confined to your prostate or they're not. So in this column, it's localized. So localized is it's in your prostate. It has not spread anywhere. Regional is it's gone to the lymph nodes. So again, for people who have prostate cancer or who have family of prostate cancer, you would know that when things spread to the lymph nodes, that's bad. And distant is distant. It's to the bones or lungs. So these are American statistics. We're trying to develop a cancer registry. We don't have a cancer registry. These are American statistics. So in America, if it's localized, so it's just in your prostate, your chance of being alive 5 years later is 100%. It's awesome. And you can't beat 100. It's mentally, it's phenomenal. I can never get over this slide. It's 100%. Right? If it goes to your lymph nodes, which everyone knows who has a family member who has cancer, and they say, oh, it's gone to the node, that's a bad sign. But in prostate cancer, the chance of being alive is 100%. So every person who has cancer who goes to the lymph node, they're still alive. I didn't say what shape they were in, but they're still alive 5 years later, right? Every person. But you see where the drop-off happens, right? So once it's spread to your bones or your lungs or whatever, then you're in trouble, right? It drops quite sharply. And that looks bad, but it's okay in the States. And the reason why it's okay is because 100% is cured if it's localized, right? And in the States, 80% is localized. So basically, almost everybody is alive. Almost everyone is cured, right? Because the amount of people who have distant disease in the States is minuscule. So keep that in your mind. 80% in America, it's localized. Everyone lives. Okay. So if that's the case, the US says we shouldn't screen for cancer. It's very controversial even in the United States, but they're very clear, like how we have breast cancer screening and cervical cancer screening and stuff. In the States, they said don't bother. It's very controversial. Because the evidence is so poor, it doesn't make any difference because everyone's living anyway. All these people we're diagnosing, maybe we didn't need to diagnose them. Maybe they would have died of something else. So they said, we don't need to screen. But that's not true here. I mean, it couldn't be any more different here. It's phenomenal, right? Because I just finished telling you that 80% are confined, right? But in the Bahamas, it's about 20%, right? Which is good, right? Because if you're in the 20%, you're going to be okay. Yeah. You're straight, right? But then what happens to the other 80%? You see what I'm trying to say? Okay, so it's a big drop-off. We're not so good at statistics. I got this off the government's website for statistics. Don't worry about the numbers, but cancer of the prostate is number 9, which is interesting. This is causes of death. Because only men can get prostate cancer, because only men have prostates. But we're still number 9. And number 7 is breast cancer. And actually, it's very close. It's very close. So for every person who's diagnosed with breast cancer, there's actually someone who's diagnosed with prostate cancer. And for everyone who dies of breast cancer, someone has died of prostate cancer. But you don't quite hear about it as much. The awareness of breast cancer is actually much, much better. And Dr. Shea will tell you, when you die of prostate cancer, PMH, the intern fills out the death form, and they usually don't write prostate cancer because you died of pneumonia or a heart attack or a stroke or something like that. So I think it's probably an underrepresentation, right? They don't say you died of prostate cancer. You died of something else. So 2 gentlemen who passed away recently, I don't know what they put on the form. But it might not have been prostate cancer. So I've sort of answered the first question, right? Why are people dying? dying because there's delay in diagnosis. And just anecdotally, and we think it's a more aggressive cancer here too. It presents much earlier. So in the States, the average age of presentation is 66, 67. Here, anecdotally, it's much younger. And it really is the delay in diagnosis because every person I've operated on in the Bahamas is alive today. That's only like 4 or 5 years. But I just showed you a slide. They're all alive anyway, right? So it's the same as the States if you operate on people or if you do radiation for people, if it's localized. The older you are, the more likely you are to get it. But again, this is an American graph. So in the Bahamas, the graph will be shifted to the left. People are diagnosed here much earlier. So you're more likely to get it if you're a man than a woman because women can't get it. It's only men. So being a man obviously is a risk factor because if you're a woman, you can't get it. Being older is a risk factor because if you're younger, you tend not to get it. And being black is a risk factor. Not that white people don't get it because I have white patients too, but the risk is higher if you're black. And the chance of you dying is higher if you're black. It's actually quite a big difference. It's very interesting because my government statistics say for Bahamians it's 29 deaths per 100,000. In America, it's 44, so we're beating them. Yes. But I'm not sure it's quite right. Right? But on paper, we're not as bad as you think on paper. But anyway, it's higher if you're black compared to if you're white. This always blows people's minds, so I put up the slide. I mean, it's about prostate cancer awareness. I wasn't here to talk about prostate cancer, right? But if your dad has it, the chance of you having it is twice as much. For reasons that aren't quite clear. If your brother has it, it's higher. It's 3 times as much. And then remember in the States, you're diagnosed later. So this third point, it says if you have a first-degree family member who's diagnosed age less than 65, because in the States that's young, but here that's normal, it's 3 times as much. And then if your father and your brother have it, or your father and your uncle have it, then it's 5 times as much. So typically when I see people, I'll see people, and like I saw this week, and his brother has it and his father has it. And his PSA is high, but he's unsure whether he wants to pursue this. But, I mean, it doesn't mean he has it, but it's higher. In a subpopulation of people, it's already very high. I was not going to show this slide because people, fatty food, I get no traction with this. So fatty food, polyunsaturated fats, our diet's terrible. Everyone knows our diet is terrible. There's not good data for this, but there's some data for this. Inflammation is a risk factor too. Certain hormones, androgens, estrogens could be a risk factor. Not to go into technical details, but it's something called insulin-like growth factor, which is related to a higher risk of prostate cancer. Sexually transmitted disease, some studies, maybe it makes you a slightly higher risk. And if you're heavy, your cancer tends to be a more aggressive cancer than if you were slim. So it's very interesting because in America, they're saying it's not worth screening. Because they overscreen. They screen too many people. They get the blood test too often, and they go to the doctor too frequently. And here it's exactly the opposite. It's mind-blowing. So I still find it mind-blowing. So I tell people you should just get the test and get the prostate examination, and that leads to any number of conversations. The blood test is just a blood test. It's a blood test like any other blood test. So certain primary care doctors will just do it when you reach a certain age. It's controversial in the States because it doesn't necessarily mean you have cancer, right? If it's high, it doesn't mean you have cancer. If you look at the slip of paper, it says less than 4 is normal, which is unfortunate. Because that implies that if you're above 4, you have cancer, but that's not true because lots of other things make it go high. So if you have a big prostate or you have infection or inflammation. But the higher it is, the more likely you have cancer, right? Which is what I said there. I told you it was a new talk. Right. So there's an overlap. That's all that's meant to show, right? So if your PSA is 2, that's very good, but that doesn't mean you don't have cancer. So last year, I operated on 3 people whose PSA was less than 4, right? Their PSA is normal, right? Similarly, I biopsied people whose PSAs have been high. By high, I mean 15 or 20, and it comes back as no cancer. That's possible too. Then you start drifting over here. You know, if your PSA was over 100, it probably is cancer. I mean, it could be something else, but it's probably not. But there is an overlap, so it's not a perfect test. And why am I explaining this? Well, it's not a perfect test. You need to have something else with it just in case. So how did I operate on the people with the PSA less than 4? Well, because I examined their prostate and I felt something that I thought was suspicious. And that's why. Among doctors and medical students, I get some pushback. It should take 3 seconds. I don't know. I see the medical students. I try to teach them. They clearly take longer than 3 seconds. And I think that's a deterrent. But I mean, you're only trying to see the size and if there's a lump or not. I mean, if you know what you're doing, it's very quick. If you just take your finger and rub it over your nose, you can feel a lump. If you have an acne bump, you know, boom. That's a 3-second job. So it should be very, very easy. And for people who come and see me, once they get it done once, it's not a problem. If they're taking longer than 3 seconds, you should ask them questions. So again, it's a short talk because I was more interested in questions. But you should know your family history and you should get checked. And obviously, if your PSA is high or rising, if you have a good doctor, they're going to send you to a urologist anyway to check it out. Thank you.
At the brink of the hill on East Terrace is the Cancer Caring Center, a comfortable, secure, and tranquil space. This 2-story facility has 10 spacious double occupancy bedrooms, each with an adjoining balcony that overlooks southern New Providence. It's the ideal home away from home for our Family Island patients.
Patients referred by our branches in Abaco, Central, South, North Andros, Cat Island, San Salvador, Luthra, Exuma, and Freeport Grand Bahama, as well as other family islands, receive white glove treatment.
The Caring Center is staffed by a qualified team who exemplify the center's motto, caring and sharing. For more information about the Cancer Society's Cancer Caring Center, call us at 323-4482 or 323-4441.